Good afternoon. My name is Selena Coleman, and I'm a patient of Interfaith Medical Center. I've been going to Interfaith Medical Center for years as a patient, both here at the hospital and at Bishop Walker Center. That's where I get my care now. The concerns I like to address is the quality level of care by the doctors, the residents, nurses, techs, and administrative staff, which is really important. Because there you have staff that's overworked, the doctors are overworked. It doesn't make sense how a patient come in at 9 o'clock in the morning and has to sit there all the way until maybe 11:45. Then lunchtime, they haven't been seen by the doctors yet. Because the doctors wasn't relieved for lunch, there's nobody to relieve another staff person. And it's overwhelming. The staff are unhappy, and that makes the patients be unhappy because you say happy staff, happy patients. So I believe that's very important. Patient advocacy, we don't have enough resources, referrals. There's several clinics that's there that need highlight attention, such as the sickle cell clinic that's there, which doesn't have much awareness about that. We have people that come in for lupus, that's the arthritis clinic. They don't have support groups to support those causes. I'm a big advocate as far as awareness. Autism awareness. You have a lot of patients that come into Bishop Walker Clinic that's autistic.
That's right.
And the type of care they have to wait. You know, autistic child, their tendencies, they can't sit too long to wait to see a doctor. So that's also something that needs to be addressed. Our senior care, the seniors that come there at the clinic as well, need also to be looked after more better than they do. And what I can say is new and improving equipment, because some of the equipment is old, it's been there for years.
Exactly.
The x-ray equipment, the tools that they use to do blood pressure are outdated. And basically that's about it, as far as we need more resources.
Thank you so much, Selena. Thank you so much. So as I mentioned before, that when some of our elected officials came, we would have to sort of deviate from the list, right? Yeah. I'm happy to, where did she go? Oh, there she is. I'm happy to see Assembly Member Latrice Walker, and Assembly Member, if you want to say a few words.
Oh, let's keep it going.
Okay.
Pleasure to be here.
All right. And in addition, we have our very own Brooklyn, and actually a member of our interfaith family, our public advocate, Tish James. And Tish, did you want to say something? I was counting on you.
So good afternoon, everyone. So first to all of my colleagues in government, and of course to the leadership of Interfaith, and to all of you who have assembled. I understand, I've been informed that most recently there's going to be a study of hospitals in Brooklyn, because hospitals in Brooklyn, a significant number of them are facing challenges, and that for Brooklyn we need to face the changing role of, the changing face of the healthcare industry in the city of New York as a whole, and that we need to keep pace with the change. I've also been informed that there's been a study that has been commissioned by the governor of the state of New York, which is separate and apart from the Berger report, and another report is going to come out being done by Northwell, if I'm not mistaken. And some have raised concerns with respect to Northwell. Some have raised the specter of the issue of conflict, because they too offer health care, and how can an organization that is offering health care actually do a study of health care in the borough of Brooklyn? I'm so glad that we are having this today, because I think no one can do a better study than the people who live and breathe and work in Brooklyn, right? So hold your applause, because I have to get through this. And I think it's also critically important that we hear from people on the ground who operate Interfaith each and every day, and the elected officials who represent the individuals. You all know that I live not too far from here, and you all know my story. And my story is this, and I hope I can get through this without crying, but if I do, just work with me. You all know I had a nephew. He's still my nephew. He's still with us. And you all know he would have been 8. And you all know that 2 months ago, all of you prayed with me, and you all held me in your hands, and you all comforted me because we lost my nephew. And you all know that he died from brain cancer. And you all know that as the public advocate of the city of New York, people tell me that, you know, I'm supposed to have some power, right? But when it came to this illness, I had no power. All I had was my faith, and all I had was all of you who love me dearly. And you all know that I went to all the fancy hospitals in this city. I went to all of the fancy hospitals who have high-paid lobbyists and high-paid lawyers, and I went to them saying, how can I help this little boy? Is he suffering from autism? Is he suffering from, what is he suffering from? And they said, oh, Tish, it's just, you know, he's high on the spectrum for autism, and just let him rest. And it'll be okay. Go to specialized schools and make sure his caseworkers and his social workers attend to his needs. And then he had a seizure. And we were close. His mother was close. His mother works here. And the only place that she could think of, because she couldn't reach me at the time with me and my fancy hospitals and my fancy lobbyists and the fancy lawyers who associate with these hospitals that get a lot of resources from all of us in this room, she took him to the hospital that she knows, and that's Interfaith. And it was here. It was here, in the midnight hour, on a Friday, where they diagnosed that he had brain cancer. No one else. No one else. None of the fancy hospitals. None of the fancy hospitals with high-paid lobbyists and high-paid lawyers. This hospital, a hospital that is like, sort of like a family. This safety net hospital that serves broken lives and broken people that you put together. It was this hospital that diagnosed this disease that which ultimately took his life. This is a hospital where, you know, in central Brooklyn, so many individuals depend upon, like my family. A hospital where the people have nowhere to go. We have a lot of stresses in this neighborhood, in this community. People who are struggling each and every day just to make ends meet. People who need someone to talk to, and people who need someone to put their lives together. And there was once a saying that it's easier to deal with a broken child than it is to deal with a broken adult.
Come on.
But you do it right here. And so we don't need a study. No one has to tell me that this hospital should continue to grow and be supported by government.
Exactly.
That this hospital that serves people who can be very difficult, but understand that life is difficult, and sometimes life, you know, gives you a hard hand. It's this hospital, those people who are rejected from all these other fancy hospitals because they're too difficult to deal with. That they yell and they scream and they curse, and that there's a lot of anger in their body. This hospital holds their hand and says, I understand. This hospital, where people who are on drugs because they've given up, because no one else believes in them, and people who have forgotten them, and because they represent ruined lives. They represent the forgotten in our society. It's this hospital who says, I'm going to walk you through recovery because you're my brother and my sister, even though I just met you 2 minutes ago. It's this hospital that needs to continue to be supported because so many individuals who have no insurance, who are underinsured, who walk in here homeless and walk in here with all that they have, oftentimes in paper bags. And they smell, but you don't say anything. They curse, you don't say anything. They're the difficult people that other hospitals in this borough reject.